Hi, welcome to the Patient Education Series. I'm Darren Bernard, physiotherapist. I'm here again with Jonathan Walzak, who's the consultant orthopaedic surgeon. Today we're going to talk about injections and corticosteroid injections and PRP injections, which I've just forgotten what they stand for. Jonathan will tell us. How you doing,
Good afternoon, mate. Love to see you.
First question, What is a corticosteroid injection compared to what is a PRP injection?
Good question. We've been using corticosteroids for many, many years. PRP is more recent. What corticosteroids are the most powerful anti-inflammatory drugs that we possess. And they are injected around a tendon, into a joint, around soft tissues to reduce inflammation, to reduce pain and let the condition repair. It also lets patients do the exercises more thoroughly because there's less pain and swelling there. They may last for 6 weeks, 3 months or so, but hopefully by the time they've worn off, the condition is better or the physio has kicked in and the muscles are stronger. And this is an example, this tiny little ampule. This is a depamedrone, a powerful steroid. It's literally 2 ml, comes with anaesthetic inside it. People imagine it's going to be pints and pints. It's a very small thing. So steroids actually reduce inflammation. PRP is platelet-rich plasma. So what we do is we take about 15 mils, a thumb's worth of blood, centrifuge it for 5 minutes, spin it down, and get what they call the buffy coat, the layer of platelets. This is about 5 mils. And then inject that into the joint, into the soft tissues. But it's the exact opposite. PRP is obviously natural compared to synthetic, but it actually contains growth factors which help the tissue to repair and also help new blood vessels grow in there. So in a kind of way, PRP is almost pro-inflammatory, inflammation bringing healing tissue,
Yes.
and steroids are anti-inflammatory.
Yes.
The quick other thing to say is steroids tend to work quickly, PRP tends to take longer to work. The upshot of both of them is quite similar, but that's the basic difference.
Yeah. And are there any risks with corticosteroid injections and PRPs?
Absolutely. I mean, corticosteroid injections can cause a little bit of local pain. If you inject in a joint, you can get a flare where the joint becomes inflamed for a few days. There is a slight increase in your sugar if you're diabetic for a couple of days, take more insulin, and they can cause loss of pigmentation or a little bit of fat atrophy around the skin. But the long-term effects are very small. There was a concern over the year with COVID that injections were going to be making your immune system weak, increasing the risk of COVID, but now we use dexamethasone as a treatment for severe COVID,
Yes.
which is a powerful steroid. I think that's not the case at all. So on the whole, they're simple and safe and be used for many years.
Yeah. And corticosteroids have been around for so much longer than PRPs.
Yeah.
In terms of success rate of corticosteroids and PRPs, as I say, PRPs have not been around as long. Both successful. What would make you choose one over another? One pro, one anti-inflammatory. I get that, but why would you choose one for a particular patient?
Good question. Traditionally I've been using steroids for the best part of 30 years or so they would be my go-to.
Yes.
If people didn't respond to steroids, then I'd say PRP is the next option on that. If someone said, I want a quick fix, steroid now and see. If they say, I'd rather let my body repair itself, I'll go for a more holistic and natural way, I would try PRP, but I'd have to warn them, you're looking at a longer recovery. And also there's many, many years of evidence behind steroids, and PRP less so. Although now the NICE approves it for injections into the knee joint and around tendons there. Several insurance companies still quibble, but it is actually a NICE approved procedure.
Yes. There you have it. The differences between corticosteroids, CSIs and PRPs. Obviously, Jonathan will discuss the benefits, advantages and disadvantages with you and decide which one. In terms of what we're seeing, we're doing pretty well when people come to us. They have the injection to get that window of opportunity so we can get joints moving, so we can strengthen up and get function back. Thanks for watching.
Thank you.